Hi, I'm Dr. Fred Venditti, the Hospital System General Director here at Albany Medical Center Hospital. I'm joined today by Dr. Lisa Mursawe, our Chief Nursing Officer, bringing the update from Albany Medical Center. So Lisa, let's go to the first slide. We always show this. This is the inpatient activity across New York State. And you can see it's kind of flat and certainly well below where it's been in prior outbreaks of this pandemic. The next slide is the census of inpatients across the Capital Region. And this one's kind of interesting. We've been hovering now, Lisa, for about 2 weeks, somewhere in the 110 range of inpatients.
So kind of plateaued.
It's really kind of plateaued, that's right. The next slide that we'll throw up is the census here at Albany Medical Center. And you can see the same thing, right, Lisa?
Mm-hmm. Right.
We're plateaued, and again for about 2 weeks now in the mid-20s,
right,
plus or minus a few. Today we have 27 in the hospital. 9 of them are in ICU. 2 of them are ventilated, and there's something a little unusual today in terms of our census, right?
Yeah, we're starting to see an uptick of pediatric patients.
Yes, that's right. So today we actually have 6 children
Right.
in the hospital
Right.
under the age of 13, and I think all of them are unvaccinated.
Right.
So that's certainly something that's happening nationally, and we're seeing it as well. The last graphic we'll throw up here are the ins and outs. So the bars above the line are admissions and below the line are discharges. And again, it fits with our sort of flat census. We're kind of matched
Right.
in terms of what's happening. So let's actually talk about length of stay next. So let's throw up the length of stay graphic. It's Thursday, and we do like to keep this in front of our staff to make them aware of where we are and encourage them to work on it. Lisa, this also is kind of flat, right?
Right. Right. You know, we're challenged a bit with length of stay and throughput. I think we're all a bit squeezed right now.
Yes. Yes. So we're about 5.8 days, and we've been hovering there for the better part of a month. So it's very important. We talk about how important this
Right.
is to get people on to the next venue of care that they need to go to.
Or back home with their families.
Or back home with their families, right. Absolutely very important. So moving on to yet another topic. School started yesterday,
Yep.
and this is typically the beginning of flu season.
Yeah.
Right. So I think there's been a projection that we've heard about recently.
Right. There was a recent study that came out, and it's really projecting something quite amazing.
It is. So this is from the University of Pittsburgh School of Public Health, and they used a program. I'll read it to you. It's called Frame Wave Reconstruction of Epidemiologic Dynamics, otherwise known as
Fred. So you just wanted to have that for the Fred.
Right, right. But basically they put a whole bunch of parameters into a theoretical population and try to predict what's going to happen during a flu season. And because last year basically there was no flu, there's very little natural immunity that's carried forward into this year. So the model projects, you know, really quite a substantial rise in flu cases compared to normal.
Right.
I think 20% was the number in that study.
Right, right.
So we'll see if that happens. I hope not, but this is a software package that's been used in the past to predict flu seasons.
So important to get your flu vaccine. We just received the vaccine in this week.
That's right.
So
several thousand doses, and
Yep.
we'll get more. So soon you'll hear from us when flu clinics are operational, and we'll do all the things we normally do to deliver the flu vaccine, having people on units and in various settings to vaccinate folks. It's going to be very important this year. Something else non-COVID. Next week is?
Next week we're actually celebrating our staff and having a picnic. So we're going to do that socially distanced, outside. It's next Thursday from 11 to 4, out by CDPH.
CDPC, right.
CDPC.
The big field right behind them on Myrtle. So I think it's Brooks Barbecue which is what we
Delicious.
do every year, which is delicious. And this really is an effort on our part, on leadership's part, to thank in a small way our staff for all the hard work that they've done, particularly the last year, 18 months. It's been
Right.
hard.
It's been very hard.
And so this is a small token of our appreciation for all your hard work.
So the seating is socially distanced. We're going to ask folks to be mindful about how and where we eat. Please, if you take meals back to the nursing units, back to your area of work, be mindful of that so that we're keeping each other safe and keeping yourself safe.
You'll notice when you go out that there won't be a lot of tables and chairs, and the chairs will be widely spaced. Please don't try to bring them to another table. They're going to be spaced that way on purpose to try to create social distancing, which is really important.
And I think we'll have some volunteers going around too, just to kind of remind folks of those safe habits. So
Absolutely.
Yeah.
And some senior leadership will be there. Usually we're all there. Unfortunately, next Thursday from 12 to 3, right in the middle of the picnic, is the board meeting, the Albany Medical Center board meeting. So many of us won't be there during that time, but still important that we do this for the staff. So, we talked a little bit about length of stay and some of the flow problems. We've been working on that, right, Lisa?
Oh, absolutely. We're doing a lot of small tests of change, trying to see where we can make some improvements for throughput and for patient care. So we're opening a fast track in the emergency room.
Yes. And it really got put together literally in days, didn't it?
Right. And it's been open now for, what, 2 weeks?
It's about 2 weeks now. And they've seen between 9 and 20, maybe a little bit more than 20
Right.
patients in an 8-hour session. So the idea is to decompress the ED a little bit
Right.
and allow the sicker patients to be in the formal ED, and people with lacerations and less more minor conditions to be treated in the fast track.
With less wait time.
Absolutely. So I think the wait time has been what,
Under 60 minutes.
Under 60 minutes.
Absolutely.
Yeah, so that's terrific. And we've done something else recently, right? There's a hospitalist now stationed in the ED.
So the hospitalists can see patients in the ED, write admission orders, and get that care started right away, so we can start healing.
So those are only two of many changes we've been making in the last couple of weeks to try to improve flow through the hospital and deal with the volume that we've been seeing. So shout out to not only the teams that worked on those two initiatives, but really to everyone who's been working on ideas and initiatives to try to increase the flow through the hospital.
And
Speaking of shout outs, there you go.
Shout out to Stephanie Yachty, who is our most recent Daisy Award winner this week from D4 Medical Cardiology. She was taking care of a patient who was a Spanish-speaking patient who didn't speak any English whatsoever. During times of COVID and visitors were restricted, the patient really was comforted by Stephanie's care. Stephanie FaceTimed with the patient's family and was able to check in on her and really coordinate that care and make her feel at ease. And so she wrote this beautiful letter thanking Stephanie for all of her love and her support and her nursing care. And so that just really exemplifies the care that our nurses give every day.
That's really fantastic. Congratulations, Stephanie. We really do have the best nurses.
Yep.
Don't we?
I agree.
And the DAISY program is just absolutely a fantastic way to recognize them. And there's a reward not only for Stephanie, but for her whole unit, and that's the cinnamon buns that get delivered.
Yep, they're delicious.
Yes.
The DAISY Award was actually started because a patient was very ill and he was dying of ITP, and he loved Cinnabons and he loved his nurses. So that's how that all got started.
Fantastic.
Yeah.
So I think that's probably it for today. This weekend is Labor Day, so it's a 3-day holiday weekend. It's an opportunity for those of you not working this weekend to decompress a little bit. we would say be careful.
Yeah.
Try to avoid circumstances where you might be exposed to COVID. You know, wear a mask, social distance, but try to decompress a little bit. For those of you working this weekend, we thank you. You're doing this for the benefit of your community, and really that's just a fantastic thing. So with that,
Thank
we'll
you.
see you. Thank you. We'll see you next Thursday. Take care of yourself and take care of each other.
Stay safe.
Stay safe.